Hello, and welcome to Spine Talks. I'm Dr. Rita Roy, CEO of the National Spine Health Foundation. I'm here at the Lumbar Spine Research Society meeting, where we have the opportunity to bring unparalleled access to world-class experts like the doctors who are joining me today. I'm delighted to have this program be moderated by the chairman of our Medical and Scientific Board, Dr. Tom Schuler. I'm going to turn the program over to Tom now, and he'll introduce our panelists. Tom?
Thank you, Rita. Well, it's so exciting to be here at Chicago, bringing you more knowledge about what are the best treatments for your neck and back problem. Today, we're focusing on back because we're at the Lumbar Spine Research Society. We're very fortunate to have two of the lead people from this meeting. So we got Dr. Bruce Darden, who's president of Lumbar Spine Research Society, and we have Zorica Buser, who is the program director. So both of you doctors are here. So Bruce, would you like to introduce yourself a little bit to the audience?
Sure. As Tom mentioned, I'm Bruce Darden. I'm a practicing orthopedic spine surgeon in Charlotte, North Carolina, and have been involved with the Lumbar Spine Research Society since its inception 15 years ago, and I'm currently president of the organization.
That's great. Zori?
Hi, everyone. My name is Zorica Buser. I'm a director of research and regenerative medicine at Gerling Institute and also an assistant professor at NYU. I've been part of LSRS probably for the last 8 years in different functions, and definitely excited to be here today and contribute to the knowledge and evidence when it comes to spine.
Well, thank you. Thank you both for being here and taking the time out of this busy meeting to share the information. So we're going to start with a word, to come up with a word to describe where spinal health care, especially in the lumbar spine, but in all spinal health care, a word to describe what it is really today. And for me, that word is easy. It's miraculous. The ability to take people's lives and improve them, to stamp out a bad degenerative disc or a unstable situation with minimally invasive technology, regenerative, maybe artificial discs, whatever. We have technology today that's really evolved over the past 3 decades and is a game changer. So that's my word. Zori, your word?
For me, it would be exciting. I agree with you. So we've come really far when it comes to spine, lumbar spine, cervical spine, and the care. If we just take a little step back, and I looked it up, back in 1970, we had only 300 publications that focused on spine innovation. And now in 2020, we are over 7,000. So that really speaks to how far we've advanced and that there are many more challenges, but also an exciting path for us in finding the best treatment for every patient.
I think my word would be progressing. It's over my over 30-year practice. It's been really interesting to see the changes that have come about. And when you can put things in perspective from that time where we started in the 80s and how rudimentary a lot of our treatments were to where we are now, it's really been exciting. And to see treatment progress, to see our knowledge progress, just like in all fields, but we're adopting a lot of technologies that we'll talk about, AI and other things that have really made a difference and will continue to make a difference in the future.
That's great.
I have a word.
Go ahead, Rita.
And I'd like to share my word, and that is hope. And for patients who are suffering out there, and there are millions of people who suffer with low back pain, we're talking about low back pain today. We have progressing, we have exciting, we have miracle, and all of that put together equals hope. And so there's hope for people to find the right treatment for their condition from qualified experts to get back to their lives.
Well, that's fabulous. Actually, it plays right into what we do at the foundation. We are here to provide knowledge, which gives hope. So with that understanding that knowledge is the key, let's start with you, Bruce. I mean, 35 years in practice. I'm 31. So we've lived through this evolution. What impact does research have on the changes? And why is it important for the public to know that we're doing research on the spinal healthcare?
Well, our charge is first to do no harm. And so there are a lot of treatments out there that have looked good at first, but maybe didn't stand up the test of time, or products and treatments that, after being tested, have been found to be safe and effective. And that's one thing that we do in this research world, is to make sure that our treatments are safe and effective for our patients. And I think that's where organizations like Lumbar Spine Research come in, to really let patients know that we have their interest in mind, and have developed treatments and continue to look into treatments that will be effective but also safe for them.
That's great. Dr. Buser, you're an elite researcher. So what is your perspective of research and the impact it has on healthcare?
If you go back to the numbers that we have over 7,000, when it comes to innovation, low back pain is such a complex problem. And for our patients, it can get really confusing. What are we trying to treat? How we are trying to help them? So with that research, we can really use an approach to address, is that pain coming from the spine? Are their hips okay? Do they maybe have depression, or are they having other risk factors that are contributing to the pathology itself? And how to really find and tease out information so that every patient gets the right treatment. And that's where I think the research is very impactful. At the same time, because there is so much research, and as Bruce said, with AI and advances in technology in spine, there is also research that we have to really, as providers, patients, and regulatory, all stakeholders, we have to be very careful, because not all research is good research. So, yeah.
Bruce, you want to add to that?
Well, I think one thing I would like to mention is that, for the vast majority of spine patients, the treatment is not surgical. It's conservative. It's lifestyle change, and nobody ever wants to hear that. There's a great little cartoon that has two booths. It's got one for lifestyle change, and it's got one for pills and surgery. The line is in the pills and surgery category, and not the lifestyle change. But that is a tremendous point, and something that has to be made aware for patients, that it's not something that we do for you and everything's going to be perfect after that. You've got to be a stakeholder in this. You've got to be active and participate. And, a lot of us have gotten away from that. I think that's part of our education, to say, we've got to change the way that we look at this problem. And we don't want to convey that everybody needs surgery and everything will be perfect right afterwards. You have got to participate in this.
Oh, that's a wonderful point. I know that in my experience, less than 10% of patients go on to surgery. So it's a small percent. It's not just most don't, a minority actually have surgery. And so while we have these amazing surgical techniques, nothing takes the place of keeping your weight under control, exercising, fitness, flexibility, diet. So all those things are those lifestyle changes that even if you have surgery, you have to do your part if you want success. And I think that's the important thing take home for patients, is to understand that this is a partnership. You don't just go to the auto mechanic, get your car fixed, and everything's fine afterwards. It's a question of saying, what are you doing on your part to achieve the ultimate success that you want? But then also, are you contributing to avoiding surgery if you can? And had so much of that.
Well, and I'd like to add to that, as a spinal patient myself, so much of what we talk about in the foundation is the journey to spinal health. And having been a patient, my surgeon said to me, I'm going to do my job. I'm going to do a very good surgery on you. You have to do your job too in the recovery process and the lifestyle, ongoing, maintenance and taking care of our bodies, because our bodies do change over time, and certainly our spine changes over time. So I have found personally that spine care is not a one and done situation. It's an ongoing thing. So whether or not you have surgery, like Dr. Darden says, or even if you have had surgery, there are lifestyle changes that have to be made to stay healthy if you want to be in the game of life. And that's what we all want.
And I think I would like to add to that, it's really important. In the past, again, going back to research and the new technologies, we believed that spine problems were because we were getting old and everything, right, just getting old, falling apart. But that's not the case. So it's really important to stress that young people have spine problems, not just athletes. So to Rita's point, we have to be careful and conscious to take care, and if there is an issue with spine, to address it early on and not wait.
So it's magic pills, surgery may be beneficial, but it's not the answer by itself. And that's, I think, the important take-home message. So Bruce, we've witnessed so much change. And I think we went from a time where the treatments were either you live with it, maybe get an injection, you might have a little micro decompression, or we shave a little bone off or leave a nerve, or we fuse the spine. To today, we have a much broader array of treatment. Can you talk a little bit about the options out there and the evolution?
Sure. Unlike, say, like total hips or total knees, there's one treatment basically, and that's what you do. And there you have it. But with spine, there's so many different problems. There's leg pain or arm pain, neurological conditions. There are back pain, which very honestly, we're not as adept at treating surgically back pain as we are, arm and leg pain. So your symptoms and your pathology, what's causing the pain has to be taken into consideration. And the treatments can vary, greatly from something very simple, as you mentioned, a microdiscectomy or a very small outpatient decompression of the spine, to something, much more involving fusion of the spine. But luckily, these days, as things have progressed, fusion isn't the only treatment for degenerative conditions or instability of their spine. There's some motion-sparing devices where they will shore up the spine, but will still allow the spine to move.
So what do you mean motion-sparing? What does that mean?
That means just the opposite of fusion. Fusion is where you basically take two segments that move and make them one segment that doesn't move. And that has some limitations. A fusion will put more stress on the adjacent vertebra and eventually can create some problems. Not always, and sometimes there's no way around it, but that's what we would like to avoid. Motion sparing means that the treatment is not a fusion, not creating one block of vertebra from two. This is where spine continues to move, and theoretically,
talking about artificial discs. Is that what we're talking about?
That is one treatment that has some effect on the lumbar spine, not as much as in the neck, because the conditions are a little bit different, but they're devices that replace the joints in the back of the spine called the facet joints. That's being treated. There are some devices that are very easy to insert that may have some promise in stabilizing the spine a little bit, keeping it a little bit more rigid, but not to the point that the patient has complete fusion and completely loses that motion.
So it's exciting because we take a look and we say, okay, are we going to fuse the spine, which is stop the motion, which is historically what we've done. And it used to be many decades ago, you would fuse a hip joint and stop the motion. But now with the benefit and development of joint replacements, nobody would think of fusing a hip unless there was some major trauma that required it. You would do a hip replacement, keep the motion. So motion is a good thing. And when we talk about motion, I mean, the ultimate motion preservation would be something where we don't do any surgery, where we do a regenerative procedure. And Dr. Buser, you're doing research and interested in that. So let's talk a little bit about regenerative as a way to ultimately avoid a surgical procedure, a fusion, or even an artificial disc?
No, absolutely. It's a very exciting field in the spine. It's been around for probably more than a decade, and some have been looking at it from a perspective, as you said, let's prevent fusion or other surgical procedures. But looking at regenerative, it really is the question, what can we do with that?
Let's define what is regenerative. What does that mean?
That actually means to restore back that tissue to an extent that it's as healthy as possible. Or in this case, personally, when I look at regenerative disc, is to prevent further damage of the disc so that that disc stays in the shape that we need, that does not cause any pain, but that doesn't require fusion in 6 months or a year. Because sometimes when procedures don't work out, patients unfortunately are in so much pain that they are looking for another solution. So, and with regenerative medicine, we, as Bruce was explaining, we preserve that motion. And with low back pain, that means they can bend, they can continue, hopefully, to do whatever they do on a daily basis, go back to work. And I think when we think about younger patients, we want them to be able to be back at work within hopefully a couple of weeks and be productive in their daily life. And with regenerative, I think we still have some ways to go to really define what is the right treatment, as we can define surgical approaches and all the different types of spine fusion. But there have been some therapies that involve cells or other factors that have been used for disc regeneration.
So let's talk about you're saying using the word regenerative, we're putting some substance into some structure. So we got to define what the substance is and what structure it's going into.
Yeah.
So what's when you say regenerative, what substance are you putting in? Where are you getting it from? And what structure are you putting it into?
Oh, that's a tough question, and I think that's where both patients and providers have to be really careful and ask the right question. To really ask, where is that substance coming from? Is it coming from my own blood, for example, or maybe bone marrow or a fat tissue, or is that coming from a cadaver tissue or from another source? It's really important because we've all seen news in New York Times, in research journals, how stem cells have caused problems. So that's why it's really important to ask the question. So there are different variations of what's being used, but the ones that are showing promise are the ones where patient's own blood is taken and then manipulated in a way and re-injected, or using their own cells with some other solution.
So commonly, it would be a bone marrow aspirate from the pelvis to get stem cells and other growth factors, centrifuge down and then inject it in.
Well, those are a lot of really big words.
Right. Or we take blood from an arm, so from a vein, centrifuge it down, concentrate, and that's PRP, or platelet-rich plasma, which is, so I think the PRP, platelet-rich plasma, and the bone marrow concentrate are the two most common used from human, although there is some work with fat cells where people are getting like a mini liposuction, and they're taking those cells, and then they have to lyse or break the cells where they do that manipulation and then can inject it. So those are really the three common sources of that. And then injecting it into what?
Theoretically, eventually, possibly the disc, but I just wanted to ask Zori, as our biologist, to really comment on where we are at this point. Because if you go on the internet or radio every day, listen to a sports talk channel, and they're talking about regenerative medicine every day. And I'd just like to get your thoughts about where we are at this point, because it sounds very good, but
It does, and that's probably where the future lies. We want to preserve motion if we focus on spine, but when it comes to regenerative, I think we still have some work to do, and that's where societies like our Lumbar Research Society, where we all come together from different specialties and discuss the data that exists and what's been done, and try to find what not necessarily better solution or better therapy, but to challenge ourselves and see where limitations are, what we can improve. It's really important. That is why currently none of these therapies is approved by insurance, because we still need more research. We still need more clinical data that we can with certainty say, this is the approach and let's proceed with that. So very early stages, a lot of question marks.
Yeah, a lot of questions and not all the answers at this point, because I think, one take home at this point, if you have to pay cash for a certain treatment, like a stem cell injection or whatever, meaning that insurance has not approved it, you need to be careful with that. I mean, it sounds very good, and I mean, everybody wants to avoid surgery. That goes without saying. If there's a simpler treatment, that's why we're here. But it's not there yet, and I don't want the audience to think that's just because they're cool new words, stem cell, so on and so forth. It's there at this point, and we have treatments at this point to prevent, say, disc degeneration or whatever, or correct disc degeneration. We will one day, but I just don't think it's there at this point. So what we have to do a lot at this point, as Zori alluded to earlier, is to prevent as much as we can disc degeneration.
How do we do that?
Well, I mean, the simplest thing, if you're a smoker, is not to smoke.
Why?
Because the nicotine in tobacco affects vessels and hastens disc degeneration by about a 3 times factor. So some of that is not preventable by us, and I feel a little bit bad talking about this with the experts next to me, but part of it is genetically based, which at this point we cannot change. But some lifestyle factors, especially tobacco use and probably vaping products as well, that hasn't been quite as well worked out. But that's what we see a lot of, and we hate to see people paint themselves into a corner. Because if you can prevent these problems, it's a heck of a lot easier than trying to treat it.
I have to concur with you, because I think the number one thing people can do for their health is nicotine abstinence. There's over 60 carcinogens in cigarettes, and it's very destructive. It affects the ability of cells to heal and to produce the right tissues. It creates an anaerobic environment because of the lack of blood growth into the areas, which impacts not only spines, but it affects every other tissue in the body. So I concur wholeheartedly that nicotine abstinence is essential if people want to have an optimal spine health.
Yeah, and Dr. Darden, I have a question for you, for the patients who are listening today, and also for you, Dr. Buser, and that is that when it comes to stem cell treatment, there are some indications in the literature that some things can work for people, but the evidence isn't clearly fully understood. If a patient wants to try a stem cell procedure or a regenerative medicine procedure, I guess, what's the worst thing that could happen? Could it hurt them and they would regret that? Or is it just really, if I can afford it, I can try it. If it doesn't hurt and it might help, where is the state of that right now for patients?
Do you want to take this, or you want me to?
I'll let you start first.
Okay. Correct me if I make mistakes. Kind of, again, feel kind of inadequate next to Zori's background, but I mean, the reason that let's say disc degenerate is kind of a complicated phenomenon. The disc loses its blood supply, and then the cartilage cells that produce cushioning material in a disc, kind of dry up and go away. The disc actually does lose its water content because these proteins kind of help,
Fluffy.
kind of keep it fluffy, keep the water in the disc. So I always think of it as, say, a moist sponge as a cushion as opposed to a dry sponge.
Okay.
Much different there. And injecting products into a disc, if the vessels have gone away, diminished, it's kind of like planting a better seed in the desert. I mean, you're still planting it, in an inadequate situation. So a better seed in still a bad environment may not work.
That's a very helpful analogy. Appreciate that.
And the other thing we found out, if you put a needle in a disc, you are injuring the disc. That's the way we create disc degeneration in the lab, and certain animal models is to put a needle in the disc. So if you're going to do something like that, you want to make sure it's going to work. And I think that's the end goal, to be able to to treat like that with a very simple injection. But again, we're not there at this point.
So interesting.
It sounds very high-tech, stem cells, and they are remarkable in a lot of situations. Cancer treatment, early on with diabetes, but in the spine, it's a little bit more complicated.
So let's talk about research. I mean, we're at an organization meeting that's focusing on research to advance healthcare. So what exciting research developments have you seen at the meeting?
It's been all across the board. It's one thing that's really changed over the last 10 years or so are the studies that look at a lot of data. It may not be artificial intelligence looking at it, but sifting through large databases to find trends. This is a problem. Or if you're over this weight, you're not going to do as well in surgery. So looking at databases, what we call data mining, for trends in treatment or just in general health, have been very, very good, helping extend our knowledge. Who is the optimal patient? What is a problem you should avoid? So it's been very helpful in that extent, Tom. There's also been advances in getting bone to heal and fusion. Before, in years past, we would take a big graft or bone from our pelvis or other sources, to get a fusion to heal, to get, that the two segments to become one. But that has limitations. It's somewhat painful and extends a surgery, and it will extend the rehabilitation of the patient. So that's been a huge advance, ways to get bone to heal without having to resort to large, painful procedures.
Go ahead. You put the goppers.
Absolutely. I agree that it's a very exciting what we've been trying to do here within LSRS, and for obviously our patients to just get really that all wealth of research within other societies when it comes to spine fusion, trying to fuse bone, to Bruce's point, not to have to take their own bone. So there has been really a lot of progress. Also, what we've been discussing the last 2.5 days are open procedures, which, depending on patient's condition, can last for a couple of hours to almost half or a full day, to minimally invasive procedures, which can be very advantageous for older patients, where we can make a small incision, get the procedure done, maybe within an hour, depending on what the procedure is, and they can go home that same day and recover, hopefully, faster than if they had to stay for a longer period of time. So still a lot to, obviously, still we need more research and evidence, but I think our spine field has been making progress in that direction as well.
Why do we need research and evidence?
Because doing it once is not enough. So we need to test, and every patient is very unique. As we discussed, some patients are smokers, some patients maybe are obese or have other risk factors or diseases in addition to spine. So to really understand how can we help them in that care and their spine pathology, we need the clinical information, and we can only do that if we do research and look at the data, position it in different ways so that we can understand and get conclusions and then apply it back.
So we want to know what works so that we can get patients better.
Yes.
Right.
Yeah.
And what doesn't work?
What doesn't work?
Right, that's right. How do I know this will work for me?
Yeah.
Right? It's that sort of question.
And that goes back to your question before on stem cells. We need more research to answer your question. Will there be any complications, or is it going to just fail and not resolve pain?
That's a little bit of a catch-22. We need research, but yet do we do something before we have the research? How do you get the research if you don't do it? So how do you address that?
It's somewhat of a complicated question. You basically, that was why my word was progressive.
Progressing, yeah.
You have a treatment and say you're not completely satisfied with it, so let's modify this. And part of that modification is to make sure that it's still safe. And then that's the early phase of evaluating a new treatment. Is it safe? And once you've established that yes, it's fairly safe, let's see if it's as good or better than what's out there. And that's for clinical conditions, affecting a patient, that's what you have to do. You have to see this is different from an established treatment, and we think that it's relatively safe, so we don't think right up front that it's going to harm a patient. So let's see how it works, and the best way to do that is compare it to what's already out there. What you want to see, is this better? Are there fewer complications with it? Is it safer? And that's how you progressively advance the field to know that yes, this is better. And that's kind of what we see. I mean, we did fusions 30 or 40 years ago, but we had just rudimentary ways to stabilize the spine and to get it to heal. And it's been interesting to see the whole process change from instrumentation, rods and screws and whatever, to more advanced, minimally invasive techniques, as Zori mentioned, that are less painful, quicker recovery.
And I think that's what's so exciting about the Lumbar Spine Research Society and about physicians in general, is that we want to prove what works. We want to question it. We want to analyze it. We want to look at it with the patient's best interest at heart. We want to find out if we're going to have that patient trust their lives in our hands, that when we render a treatment, that we're getting you the best possible solution for your problem. And that's really the power of the research and the Lumbar Spine Research Society is that we are able to advance the field to better care for our patients.
And what we think makes us somewhat unique is that when we started the society, we did this without any commercial involvement. In other words, companies being involved. And when you're doing research, you want to take out as much bias as you can when you're doing it. And what I mean by that is the surgeon has a bias as to how he thinks his patients are doing. But if they independently report how they're doing, it may be different from what he surmises, what he thinks. And if a company that has a financial stake in a product is involved with it, they obviously have a bias to see that product do well, right? A financial reason to do it. What we've tried to do, nobody's perfect, but what we've tried to do is to take out as much bias as possible and let our research stand on its own, and to do it without any conflicts. And that is what's made our society somewhat unique, in that we try to have our discourse and our arguments as free from any secondary gain as possible, if that makes any sense.
Makes total sense. Well, this has been a fascinating discussion, and I'm going to close asking for advice for our patients. So, Dr. Buser, do you have any words of advice for people?
Ask questions. I think don't be afraid to ask many questions, to get a second opinion, and try to really get as much information as possible. As we've just heard from all four of us, research is, and that evidence is critical, and sometimes it's hard to understand it. So really asking providers to explain why they would do that approach and why they wouldn't consider something else, it's really important. And attending, given all the innovation and advances with technology, there is so much resources online. Even like our society, a lot of the meetings are pre-recorded. So instead of focusing just on one opinion, reaching out and looking for answers.
Bruce?
I think Zori is spot on with that. I mean, the patient needs to go to their provider and make sure all their questions are answered. And if they don't feel comfortable with it, just seek another opinion. The internet has some wonderful information, but it is also fraught with problems. There are a lot of sites that look unbiased, but are trying to sell a certain procedure or product. So you can get information from it, but you have to take that back to your provider and make sure you feel completely comfortable with what's being recommended. And if you don't, to seek another opinion. Feel wholeheartedly, and as a surgeon, as a provider, you have to get over that innate feeling that, I have all the answers. Why do you want to go have another opinion? But sometimes I may not be able to convey it to the patient as well as they need to. And so having multiple opinions is the way I would go, and not to feel bad about that if you're not satisfied with, where your answers stand at that point.
Oh, that's exciting. It's exciting to know that we are asking the questions, we're doing the innovation, and we're challenging that innovation with research to say, is it working? Is it making us better? So all of that is why we're at a meeting like this and having you guys share it. Rita?
Yeah, I would just say in closing, one of the things we believe in most at the National Spine Health Foundation is to bring expert insight and information to patients so that they can educate themselves to ask good questions to their providers. And we are so thrilled to be partnering with groups like the Lumbar Spine Research Society so we can bring the best of science, and hopefully in language that people can understand, and then can educate themselves to ask the right questions to their providers, ask about the things that we talked about today. And I just want to thank all of these doctors who put the best of modern miracles of science into practice every day for their patients. And we thank you, healthcare heroes, for doing that.